Viagra, Cialis, combination, gas station pills. What's the best treatment for your ED? Well, today, as a urologist, I'm going to give you the no BS breakdown of the best non-surgical ED treatments so you know what's for real and what's snake oil. And stick around to the end because I'm going to give you a simple and very effective tool to improve your erections. And here's the best part, it doesn't cost a dime. So let's go balls deep into today's ED treatments. So let's start with the bottom of the barrel, the types of ED treatments that I really can't get behind. And the reason I can't get behind them is we just don't have data behind them. And these are going to be your over-the-counter promise pills, the infomercials, the stuff you can grab at any gas station, vending machine. Listen, if someone's incentivized to make money off of you buying a pill, guess what? They're going to overpromise. And we know from studies that even a sugar pill is going to deliver 40% of the time. So it's not to say that these things couldn't potentially help you, but we just can't get behind them with the same confidence we can do things that have been studied rigorously and or are FDA approved. So the other thing you gotta be aware of is you don't know what they're putting in these pills, because if they're not regulated, you could actually be doing harm, and not enough people talk about that. So the way I approach this with patients is, listen, there's a lot of things in healthcare we don't know as doctors. And I know that's a shock for some of you to hear a doctor say the three words, I don't know, but there's a lot I don't know. And if I have a patient who's taken a pill and they feel it's beneficial and I can help in any way guide them regarding safety, by all means, I'll be encouraged, or I will encourage them to continue with it. But if you're looking for that thing that's going to help you, if you've tried all the other stuff, guys, just save your money. You don't know what you're putting in your body. And very often these pills are just empty promises. So if it's not regulated, if you can get over the counter, just be really, really wary of whether it's going to work and whether it could hurt you. Are you struggling with your performance in the bedroom? Well, you're not alone. Listen, there's plenty of options out there to get pills shipped to your house, but that's not always the right solution, and you don't know what is best. Here at Pazona MD, we offer telemedicine visits to patients across the country to get real answers from real experts. So go to the description, click on the link that's in there, and get a free 15-minute discovery call to see if you'd be a good candidate for a telemedicine visit. Guys, we get this whole thing treated from the comfort of your home, and you may not even need to go into an office. So give us a call. We look forward to seeing if you'd be a good candidate to get some help. Now, let's get back to our show. What's our fourth base solution? That little blue pill, or the combination of. These medications are called PDE5 inhibitors. Viagra, Cialis, Tadalafil Sildenafil. There are other names that are being trademarked out there by all the online pharmacies. Bottom line is, guys, they all do the same thing. They're called PDE5 inhibitors. They're releasing nitric oxide, which is a natural vasodilator to open up those blood vessels going to the penis and open up those erectile chambers. Every pill works better for different guys. So I can't sit here and say, oh, you got to do this one, this is the best, or this combination is the best. It really varies. Guys respond to medicines differently. There certainly are pros and cons between the shorter acting and the longer acting ones. So bottom line is, this is again where guidance with the board certified urologist to talk and better understand your situation is going to guide you to the best pill. But hey, these pills work. They're not going to fix anything long-term, but they can help you get immediately hard in the bedroom today so you can start enjoying your activities again. If you want to learn more about some of these medications, hit on the link down below in the description. Whether you're interested in improving erections or just frankly maintaining them, this would be the episode for you. The third best treatment, in my opinion, for improving erections are some of the non-surgical Soundwave therapies that are out there for erections. So I had a patient ask me the other day, hey doc, have you seen that new Phoenix that's online? And what do you think about this device versus that? You know, what I'll say without speaking specifically about any one therapy is, if you can purchase it as a patient, there's a possibility it's not quite strong enough to do the job. So There are these devices that are out there that can induce a change to the blood vessels and the nerves going to the penis and the erectile chambers that can actually help grow new arteries and nerves and improve erections. We have such a device at Pazona MD. You may have heard of other things like GainesWave and some other things that are out there. And these devices do work, and we do have some science behind them. The problem is my first example, that there are some people out there who are making devices that make promises, but they're not strong enough to get the results you need. And if they were strong enough, they couldn't sell them directly to you. They have to go through a medical professional. So I would just be skeptical of anything you can order on your own. If you are going to go after something that is through a medical office, make sure you're going to a board certified urologist who is really a erectile function expert. You know, a lot of these places are med spas and cash-based places, and like, oh yeah, we'll give you Botox, we'll do a facial, and then I'll help your erections better. I'm sorry, but I'm not a skin expert and erection expert. I like to believe we should stay in our lane to a degree. So if you are going to go with one of these therapies, go with a urologist who's not necessarily incentivized to just throw this therapy on you. Because guys sometimes are spending thousands and thousands of dollars on it, and it doesn't work in all cases. So I'm very selective. I feel the sound waves work best for more mild ED. But if you're more severe and some of these other treatments aren't working, just, lower your expectations, and it may not be the right therapy for you. All right. The second best thing that is going to improve your erections is changing your lifestyle. And, listen, guys, I wish that this could have a bigger impact. And in some cases, I might rank this higher up depending upon the degree of erectile dysfunction. But if we go back to some previous episodes here on Balls Deep where we covered how an erection occurs, it starts with stimulation due to hormones in the brain, leading to an opening of blood vessels that are going to pump blood into the erectile chambers of the penis. When those tiny blood vessels get clogged because of smoking, high blood pressure, diabetes, carrying extra weight, not exercising, or from a lack of hormones, that damage that occurs to some degree can be irreversible. And so for a lot of guys, these lifestyle changes can only do so much. Now, that being said, from an overall health perspective, this is the most important thing you can do. I mean, we've talked about this on Pazona MD, how it's all about lifestyle, and that's the way to live longer and live more vigorously. So I'm not saying to ignore lifestyle, but if you're looking for immediately improving erections, it's really going to be mild in terms of how much benefit you can see in the immediate short-term future. So I'm all in favor of this for the big-term picture, but in the short term and getting you that immediate impact in the bedroom, we're probably not going to make a huge stride for most guys. But nonetheless, stop eating the Taco Bell, put down that extra beer, get out, move your body, get some sleep. All these things are important. All right, so here we are, guys. What is the number one ED treatment? It's right up here. Now, we talk about in women how all sex starts up here, but it's also important in guys. We see a lot of erectile dysfunction in younger men, and the main cause isn't anything physiologic, meaning their hormones are fine, their blood vessels are fine. It's up here. It's the anxiety related to their first relationship. It's anxiety related maybe to their upbringing and their culture and religion that maybe didn't look positively on sexual activity. Maybe it's because you're watching too much porn. Porn-induced ED is a real thing. And then lastly, it's your mindset regarding going into it with your partner, having reasonable expectations, and understanding that as you age, erectile dysfunction is a common thing that happens to most guys. 50% of men by age 50 are going to have ED. It's a flip of a coin, guys, whether you're going to be in that group. And if you are, you're not broken. Doesn't mean you're not attracted to your partner. It just means that your body's undergoing changes. And the last thing I'll leave you with is using your mind to partner with the right healthcare professional. Too much ED treatment and therapy has turned to this DIY approach. And listen, doctors' offices don't make it easy in most cases. I get it. I understand why these solutions have taken off because most doctors won't talk to you about it. But we're different at Pazona MD. We can help guide you so you don't go spend thousands of dollars on things that don't work or put harmful chemicals in your body that could harm you. So with all that, Hope you found this to be useful, ranking our top 5 from worst to best ED treatments that I believe in today. And if you feel like we could be a good fit at Pazona MD, again, click on that link down below in the description and give us a call, and we could maybe just take care of this from the comfort of your home. So until next time, show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.